Senator Tammy Baldwin offers new legislation to address veteran hospitals overprescribing opioids. Talkatoo has been covering drug concerns at the VA for years now. Baldwin called for an investigation into the Milwaukee VA clinic after Fox Valley veteran Army Ranger 26-year-old Cole Schuler was found dead after a heroin overdose in 2015. Just this past June, Talkatoo's Sarah Thompson was given a tour of the domiciliary there. Officials say they made millions of dollars in changes, including tighter security. The late Marine Jason Simkuski's story is one of the most widely reported tragedies. He died from an opioid overdose while under the care of the VA facility in Toma. His death prompted federal legislation that holds doctors accountable for the opioids they could prescribe to patients. Tonight, our Washington Bureau's David Aid talks with his parents and Senator Baldwin about a new bill that strengthens opioid safety.
We are introducing today bipartisan legislation to close that gap.
More doctors who care for veterans subjected to guidelines and training aimed at preventing opioid overprescription. Senator Tammy Baldwin says that's her goal with a new bill, something Marv Simkuski approves of.
We just want to help save other lives out there right now, and that's what we're here for.
Marv Simkuski is on Capitol Hill hoping to encourage Congress to quickly pass the Baldwin bill. For him and his wife Linda, this fight couldn't be any more personal. Their son Jason died in 2014 at the VA hospital in Toma, Wisconsin.
Jason was a victim that died at the facility from over-medication, and it's tragic, but we're here to make sure it doesn't happen again to other veterans.
The VA reports existing law is working, and it's cutting back on opioid overprescription at VA hospitals. However, the VA's Inspector General told a Senate committee Wednesday that private practice doctors the VA partners with are not subject to the same opioid-related regulations as doctors inside the facilities.
Specifically, gaps in health information exchanges between VA and non-VA providers can put patients at significant risk for serious medication interaction and unintentional or intentional overdose.
At that same hearing, Marv Simkuski worked to make the case for Baldwin's bill.
We need to stay vigilant, and I'm going to work my hardest to see that this legislation also gets across the finish line.
In Washington, David Aid, Action 2 News.
Looking closer now at the bipartisan bill. If passed, it would direct the VA to provide critical health information, including a medication list, to a non-VA provider when a veteran gets services through a community care program. It would also require a non-VA community care provider to review the latest safe opioid prescription guidelines and submit opioid medications to a VA pharmacy for dispensing. If there isn't a VA pharmacy nearby, the veteran can fill the prescription at another pharmacy, but the community care provider must